Hello again, everyone. It's Wednesday and time for a little wisdom. The office has been busy and we're moving forward with seeing all of our patients these days, and that's been great. Love getting back in contact with everyone. We're still trying to see exactly how this is all going to look in the future, but for right now, we are all definitely continuing to do what we can to keep the social distancing and all the safety measures in place. So don't want you to worry or fear coming into the office. We're definitely doing all we can to protect you as you come in to see us. But it's great to see everybody. Love that. I'd like to talk about a couple of things today, including looking at how to optimize sleep. A lot of folks are still struggling a little bit with that. In terms of what types of things to take, we've used an awful lot of different types of substances to help folks sleep. We use melatonin, a lot of L-theanine, which is an amino acid, which is a calmer. We use a lot of GABA aminobutyric acid, which is also an inhibitory neurotransmitter. And today I'd like to talk a little bit about glycine. Glycine is an amino acid that has both a little bit of excitatory and inhibitory types of properties about it, but mostly it has been used as a sleep aid. Glycine tends to come in a dosage for sleep that is around 3 to 5 grams, which makes it easier to use if you get a powder. We currently don't carry a powder here, but there are numerous ones out there and would suggest that you look into that. Although there's capsules, you'd have to take quite a few capsules to get the 3 to 5 grams necessary as far as the recommendation for sleep is concerned. But we found that glycine has a lot of benefits in terms of depth and quality of sleep, in addition to helping with blood sugar control, and it's absolutely a benefit for enhancing our immune system because it's part of the master antioxidant called glutathione. It is one of the amino acids that's part of the production in our bodies of making glutathione, which is a great antioxidant. So I would like for you to consider glycine if you're still struggling with sleep, or if you're using any of the sleep apps or have an Aura ring that assesses your sleep and would like to just enhance your sleep a little bit better. You might look into adding a little bit of glycine to your protocol. The other thing I wanted to touch base on was about fasting. I mentioned that last week, and I wanted to just give you a little bit of an outline about how to get started, and for those of you who are interested, how to just get going on this. The main thing to know is that with fasting, this is not considered to be a dry fast. When you start intermittent fasting, you can actually drink coffee, tea, bone broth, and water. Ideally, you would not have anything in your coffee or tea, but if you absolutely have to put something in there, I would use some type of fat, heavy cream, or any of the nut pod type products, or certainly you could do a bulletproof coffee with butter and brain octane MCT oil. That is not ideal, but it does not really affect insulin that much. And again, the main thing here that we want to try to look at is trying to minimize insulin. Insulin is that hormone which pushes sugar into the cells, and trying to manage weight as well as an anti-aging approach to living, minimizing insulin is the important key here. Now, when you do intermittent fasting, it's not only about not eating for a certain number of hours. Typically, most people already practice, say, a 12-hour fast. Most of us are not eating anything from, say, 8 o'clock at night, 7 to 8 o'clock at night, and don't eat again until 7 or 8 o'clock in the morning. So that would be considered already a 12-hour fast. But for many of us, what we want to try to do is eliminate that early morning breaking of your fast and move that out to, say, noon or 1 o'clock. So if you finish having dinner around 7 and you don't eat again until 12 or 1, you're doing somewhere between a 16, 18-hour fast. And then the follow-up key to this intermittent fasting is eliminating snacks, and only eating in 2 small time-restricted eating periods so that you only have 2 elevations of insulin during your eating period. So it's important to try to do all of your eating in, say, from 12 to 1, and then perhaps from 6 to 7, 7 to 8, however you choose to do that, but no snacking, so that you're just having these 2 spikes of insulin. And if you maintain a fairly low carb or want to try a keto approach to eating, those spikes of insulin are going to be very, very low, which is a great benefit as far as allowing the body to do a lot of regenerative work. And the term that we're using for this recycling and regenerative work is autophagy. So that's an interesting word. Auto, which is self, and phagy, which is eating, so there's self-eating. But really what it is this self sort of recycling within the cell itself. And it helps the little powerhouses of the cells, the mitochondria, to regenerate and continue to function in a great way so that we can perform and create energy on a regular basis. This is really important when we start to see issues with fatigue and sort of malaise. So allowing the body to have this time of recycling is great, and it also helps with just cognition and focus. So this can be a vital way of not only looking at it from a weight control standpoint, but just from an anti-aging standpoint and functioning standpoint. So I would again encourage you to look at this as an opportunity for an anti-aging approach, weight control, and look forward to sharing more as we move ahead. Again, please take care of yourselves, get plenty of sleep, continue to exercise, get out into the sunshine, get that vitamin D going, get plenty of good deep breathing, try to control your stress, and have a great week, and we'll talk again next week.